Welcome back to Houston Happens, and we are turning to health news. Has it felt like your heart flip-flops, skips beats, or just feels like it's off to the races? No, you are not lovesick. These are not signs of a broken heart. These are actually a few symptoms of AFib. And here to help us understand and talk more on the topic is Dr. AFib himself. I'm so excited. Please welcome Dr. Percy Morales from Modern Heart and Vascular. Thank you so much for waking up with us.
Thank you so much for having me here today. I really appreciate you having me here to talk about AFib.
Well, of all people, if you're known as Dr. AFib himself, so tell us, what exactly is AFib?
Well, AFib, or atrial fibrillation, which is the big word for it, is the most common heart arrhythmia across the world. Is over around 5 million people in the United States and over 30 million across the globe that have this heart arrhythmia. So this is more of an electrical problem of the heart. As a comparison, when people have a heart attack, which affects the blood flow in the heart muscle, this is more of an electrical disease of the heart. It's kind of imagine it as a short circuit, something that's misfiring the heart. Instead of a nice steady heartbeat, you get rapid, irregular rhythms of the heart itself.
So what are some of the symptoms? Because I know sometimes I get nervous jitters, or nervous tummy, I say, or somebody feels jittery or anxious. So how can you differentiate?
So atrial fibrillation, like I said, is an erratic heart rhythm, makes the heart go fast, but there's a variety of symptoms about how people feel it. The most common symptom will be a sudden onset of the heart racing. Instead of a nice steady heartbeat, all of a sudden the heart will go shoot up and go very fast and very erratic. It's not uncommon that people have heart rates of 150 beats per minute when they're having AFib. So that is the most common symptom, but not everybody feels that, okay? Some people don't even feel the heart itself. Some people just feel short of breath. Some people just feel tired excessively or dizzy. And there's a small percentage of people that feel nothing whatsoever. They could not tell that they're having atrial fibrillation or AFib, and they get diagnosed on accident just with a regular checkup with their doctor.
So what are some of the risks if we don't get diagnosed?
So the biggest and most concerning risk of having AFib is risk of stroke. And in general, people who have AFib are at 5 times higher risk of stroke than people who do not have atrial fibrillation. When the heart's going very fast and erratic, it's prone to develop blood clots inside of the heart, which could then go to the brain and increase risk of stroke. Now, risk of stroke is not the same for everybody. Some people who are older are going to have a higher risk of stroke than somebody younger, but that is the most common and concerning thing about atrial fibrillation is risk of stroke. And there's a lot of treatment options to reduce that risk of stroke. Another big concerning risk would be risk of what's called heart failure. It's weakening of the heart muscle. When AFib is not well controlled, when the heart's going very fast and erratic for a prolonged period of time, maybe weeks or months, it can cause an objective weakening of the heart muscle as well.
So how do you treat this?
So there's a variety of treatment options. I always tell my patients medications are always an option, and that's commonly where people start off. There's a variety of treatment options for medications that can control symptoms, they can prevent symptoms, and even reduce the heart rate itself when people are getting episodes of atrial fibrillation. In addition, treatment for stroke risk reduction is an absolutely essential part of management for AFib. There's a variety of treatment options. Most commonly would be blood thinning medications. There's a group of blood thinning medications called anticoagulations that the grand majority of people who AFib will be put on. And so those are the common treatment options, but there's also procedures as well. There's procedures as well which can improve symptoms of AFib. Also, there are procedures that can reduce risk of stroke. A lot of these procedures are procedures that people like myself who are specialists in AFib do, and it can really improve symptoms a lot. In addition, I couldn't mention treatment for AFib without mentioning lifestyle modifications. For a lot of people, they get atrial fibrillation who either have high blood pressure, diabetes, obesity, excess alcohol usage, and these are all risk factors for getting AFib. And treating those underlying causes are also an essential component of the long-term treatment of atrial fibrillation.
Well, I see why they call you Dr. AFib. You definitely broke this down for us, and it makes sense. That's why I love all of the doctors within your practice. Where can people go for more and to book an appointment?
Well, like anything, the earlier it's treated, the better the results, and people are able to get an appointment with me at Modern Heart and Vascular. But in general, I'm very passionate about educating people with this disease, which is why I wrote a book called Your Complete Guide to AFib. It's really written as an A to Z guide for anybody to learn more about this condition and understand more of their treatment options. Anybody can get it. It's available on Amazon. But for people who are able to come and see me at Modern Heart and Vascular, I do also keep copies to give the new patients as well.
Well, thank you so much, Doctor, for your time. I really appreciate it. And now let's check in with Ito. I'm not hurting this weather, my friend.